Axial PD fat saturated image of the knee shows some amount of fluid in the suprapatellar fossa. The lateral patellar facet shows, not the lateral, the medial patellar facet shows some subchondral cystic degenerative changes in the bone of patella. Some signal changes also seen in the medial facet of the trochlea of femur. A little bit of joint fluid is seen extending into the popliteal space or the Baker's space between the medial head of the gastrocnemius and the semimembranosus. Otherwise, nothing else is seen in this axial section. Sagittal PD weighted fat head is the most sensitive sequence for detecting 95 to 98% of the problems in the knee, beginning from the medial most margin of the knee. Here we can see the medial meniscus. There's a little bit of high signal intensity, T2 signal intensity within the posterior horn that is extending to the meniscocapsular area. As I go closer towards the posterior root, there is increase in the high signal intensity with some associated changes in the bone in the posterior margin of the medial tibial plateau, close to the attachment of the posterior root of the medial meniscus, where there is high signal intensity extending to both the articular surfaces of the root, suggestive of a root tear. Here we can see the posterior cruciate ligament, which is intact. The anterior cruciate ligament is intact and is parallel to the posterior margin of femur, intercondylar region. This is the Blumensatt line, and both the lines should be parallel. The angle should be acute and small. A little bit of signal intensity is there, but yeah, nothing significant enough. As we go across to the lateral meniscus, a little bit of high signal intensity in the anterior root of lateral meniscus. But as we go towards the periphery, the anterior and posterior horns of the lateral meniscus is intact. The quadriceps tendon looks okay. The patellar tendon also looks okay. There's a little bit of edema in the Hoffer fat pad or infrapatellar fat pad. Let's go to the coronal section. Here we can see the medial collateral ligament and the lateral collateral ligament. Both appear intact. A little bit of fluid is there around the medial collateral ligament. You can see this mild periligament edema, but otherwise the ligaments are intact. In the axial section, you can also have a look at the patellofemoral ligaments. So here you have the patellofemoral ligaments on either side. This is the one on the medial aspect, and the one on the lateral aspect can be seen over here. So this is basically a case of some amount of osteoarthritic changes involving the medial patellofemoral joint, some mild effusion. There is a posterior root. When there is a bone injury associated with a meniscal tear, especially the root, it is likely to be an avulsion. So it's probably a posterior root avulsion injury of the medial meniscus, and a little bit of osteoarthritis of the patellofemoral joint. Otherwise, there's nothing else happening in this knee.